It's Jade Mindarsma. I'm here to talk to you about trauma care. This is more than first aid. This is if you get shot or stabbed, or you have an impalement, maybe you have a car accident, you are in an explosion. We're going to go over this acronym called MARCH. Stands for massive bleeding, airway, respirations, circulation, hypothermia, and head injury, but we'll get to that. So this is an assessment tool that we use, and it goes in priority of life-threatening. So with your massive bleeding, we always start with our extremities. Well, first of all, you need to find the wound, of course, right? But I like to start with extremities. You want to use your tourniquet. This is a CAT 7. The big thing is that it has this red tab. That's really important too. It's like when you're in a trauma situation and you're all anxiety and you have this red tab, it just kind of helps you. Okay. First of all, when you have a wound, you want to put pressure on it. If you're alone, you just do your best, and you want to have somebody with you to put the pressure on. You want to put your tourniquets in the high and tight position. Your natural groove of your arm, your natural groove of your leg. When you're having the leg injury, you want to always check the pockets first, and because you don't want to impale them with object in the pocket. I'm sorry, I'm getting so nervous. Oh, sure. Do you want to show?
I'm the doctor. Yes,
Yeah.
I am the dummy.
Yeah. So.
Do you want to train once? If you want to.
Okay, sure. So you want to open it up, put it on your arm, have the tab towards you. You pull it tight, really tight, yeah, and you put it in, yeah, wrap it around, put it in there.
You do that after?
Yeah. You spin your wheel.
I guess I can walk a little.
Yes. You can, yeah. You're gonna keep spinning it until the bleeding stops. And then you're gonna put the wheel in its lock position. You put this over it because that way it will not come out. And then you put this tab over it, and hopefully you have something to mark it with of what time that you put the tourniquet on. That's important to know for this doctor to know what time that you put it on. Okay? Yes, sir.
The goal of this is to occlude the artery, basically to jam it up against the bone that is in there to stop bleeding. Doesn't feel great. What do you mark the time with?
Well, hopefully you have a pen or a marker, Sharpie. But if you,
Sharpie?
Yeah.
Yeah, you can. How many of you have got a Sharpie right now? I've got 2 on it.
Yeah. Or a pen is a pen will mark on those also.
The other thing that you can do is you can put there's really plenty of blood, feet, and then the time.
Again. When you're doing your leg, a lot of times when somebody is shot, it will break the bone. Whether it's an open fracture or closed, it doesn't matter. But you want to feed it behind the knee, because if you lift the leg, then you can cause an open fracture or something was still closed, and that is a whole nother. You can kill them from that. So you will open up your, yeah, you can.
I just went. Blood stop.
You can check with the capillary refill. When you push your nail bed, you can see the blood comes back to your capillary and into your nail bed fast. And if you have the tourniquet on correctly, then blood will not come back into your nail bed. Okay, thank you so much. And then can we show them the leg?
Yeah.
Yeah. So you will open the tourniquet all the way. You're not going to go like this, because like I was saying, you can break the bone. You feed it behind, so they're going to be on the floor, and you just kind of floss it under the knee, then floss it up to their thigh, and then apply it. Like same thing, nail bed, capillaries. Now we have something called a junctional bleed. That's where the extremities meet your core. And in those instances, like many people have the metal container or hard plastic bottle, like how you can raise. Something like that is very strong. You can put like on the junctional, and you will use like, hopefully you have 2 tourniquets, but if you don't, you can use a belt. Oh, sure. 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 Mm-hmm. Well, a little bit.
A little bit more.
But yeah. So, do you mind if I use your water bottle? Thanks. Okay. So, if you can just put it on your. Okay, we can stand then.
Okay.
Thanks. Oh, thank you, sir. Okay, so put it on your groin. So you will wrap it around. Of course, you're going to have to, on the ground, you will be rocking them back and forth to try to get them.
Yes.
So, again, you will want to check the pockets first before you do this, okay?
I've been shot in the hip or groin, pelvis
Right,
region.
in your groin. This junctional bleed is where the extremity meets, like your neck, your axillary, your groin.
Why you put it on it?
Because in this instance, he got shot here.
Oh, I see. You put pressure on it.
Yes, ma'am. This is occluding the hole, and we're trying to stop the bleed of the hole. So we're going to do exactly like we do. Tie as tight as you can. Cramp those down. If it's here.
What do you mean?
No, only this side could. If we're blocking this main artery, yeah, everything below it is.
Are you hitting the artery on that
This
side
side.
to where you can put this leg that's not
Correct.
dying?
Right.
Correct.
Well, so we're mostly worrying about keeping
Shock.
Yeah, shock and was it hypovolemic shock?
Yes,
where it's just-
hypovolemic shock.
You've lost too much blood and you just died.
Yeah.
So that's the most important thing. If you lose the leg, at least you're still alive.
Right.
And that's kind of how they
Thank you.
triage it.
So you have less than 30 seconds. Oh, I'm sorry. Well, we will do the tourniquet first because that's the occlusion first, and then we will pack it for sure. One thing that needs to be highlighted is you have about 30 seconds to stop a massive bleed before you die. You will go into hypovolemic shock, which means you have a major loss of blood in your cardiovascular system, and you will die. Now, when you're alone, you actually have less than 30 seconds because you'll start getting lightheaded and dizzy, and you can't respond to yourself. So I always tell people, especially people who carry, always have a tourniquet on you and practice. What I do, and this people think is silly, I kind of hyperventilate with somebody with like not a witness, how do you call it? Like a somebody with me, because if you hyperventilate, you can pass out. But I hyperventilate and I practice putting on my tourniquet because when you hyperventilate, you can't think, right? And that's good practice for your adrenaline is pumping, and you can barely respond to a question like, what is today, right? So I think that is good practice, but you always want to do it with somebody around you because if you fall, you can hit your head, you can get hurt, okay? So extremities, high and tight, check your pockets. Broken leg, when you're doing the leg, remember it could be broken, so you want to floss it under the knee. I say under the knee because there's a natural gap here that you can easily put the tourniquet through. Floss it up, high and tight. Junctional bleeds, where the extremities meet the core. Now, we're going to talk about wound packing. Now, wound packing is really important. Even you have the tourniquet on, you still want to get a clot in there. You still want to pack the bleed. Even you think that you stop it, okay, that's really great, but you still need to pack the wound so that the blood can start clotting. So you're gonna and we're gonna do this on each other. So I'm just going through it real quick. I always take the gauze, and I have my non-dominant hand and my dominant hand, and because it's so much easier when you're packing to pull with your dominant hand, and I stuff in there, stuff the packing, and I'm feeding with my dominant hand, packing. But we'll go over that. You get your regular gauze. Hopefully you have sterile gauze, and then you will wrap it with this. When I think that we should get in groups and do this actually. Yeah. Okay. Can y'all pair up in groups?
Is it okay if I add something?
Yes, sir.
I think it's important because if he does come across, you need to make sure you have all the information that you can get.
Yes.
And maybe change, but I did 4 tours in the military, in the Army. I did 26 years, so
Yes, sir.
I'm not gonna have my time to care.
Sure.
I'm still in the military here, so you guys correct me if I'm wrong. One of the things that is important to do is once you put a tourniquet on, if you put it on your chest, what you're doing is that you're feeling that you're limited.
Yes.
What you want to do is put a tourniquet 2-3 inches above it. If the cut is here, then you put it right here. You put it here, you put it about 2-3 inches above, so that way you can save that joint. You don't have to cut it off. The other thing is that it used to be, I don't know if it is now, every 10 minutes or 12 minutes, you release some of that pressure.
No, that's changed.
Okay,
Yeah,
well,
I'm a nurse also. I was in the military.
Yeah.
So I think things have changed a little bit.
That's what I'm saying.
Yeah, just a little bit. Things have changed. So we used to tell people, like, if you have the wound, here, then you just do it. But now they want everybody just high and tight.
Really?
That's the new way or new rule. They just want high and tight. And I don't know if it's just because it's easier.
Doctors were trapped a lot of times during the recovery, especially thermal. So they found that even if you put it on, you're not actually stopping the bleed because the vessel is retracted above. And so it's still bleeding out, just bleeding out into the muscle tissue. So they want you to go as high as possible. And if it doesn't stop, then you start working the way down.
And you can stack them.
You start as high as you possibly
I think
can. Where's
yeah.
that? Who came up with it? It's the recent changes to TCCC.
Yeah,
So
I think,
combat lifesaver teaches you that way. Okay.
there were a
Yeah.
couple situations where they had found that they had retracted up during EWAT, and there was another time where it was actually a corpsman that had released the tourniquet on himself, and he bled out because of that. It was too painful, and he just wanted to release it. He knew better, and still he had that tourniquet on.
Yeah.
They said that you can actually keep tourniquets on for 18 hours, I think was the longest recorded use. And it was a guy that was, I think, hit by an IED in southern Afghanistan, and they flew him to Germany, and they kept the tourniquet on the entire time. And he was fine. He gained use of his arm.
Yeah, technology have come such a long way since we served.
Yeah.
And another thing I think I forgot to mention is that if it doesn't stop, if the bleed doesn't stop, you can call what stacking tourniquet is. You can put another one on. So let's say let's say you, sir, you were taught a different way, and and it doesn't stop bleeding, and then you can put another if you want. Right. So we call it stacking, and a lot of times that will be in your femoral because it's just stronger. Good morning. So wound packing, can we get in pairs of? Well, I don't think we have enough for. Can we get in groups of 4? Yeah?
Yeah.
Awesome. Okay. Okay.
Team number 1.
Okay. Here's some gauze for y'all.
What are we doing? Wound packing?
Yes, sir.
You already did.
Yes, sir. Well, we can practice the tourniquets also. Okay. Here's some.
Just need gauze for that.
Yes. You're welcome. And then some practice.
We're gonna try to do what y'all are doing where we're at.
Oh, nice.
January 8th, we're having a meetup, similar type subjects
Awesome.
in basketball.
Awesome. Okay.
I'm John.
I brought some more supplies too.
Oh, thank you. Okay. Here we go. Some gauze and practice roll. And then last team over here. Okay. Okay. So we're gonna find our
Eyeball.
Watch over here.
So we're gonna find our wound, and y'all are just gonna pretend on each other that you have one. What I do with my Boy Scouts is I have them make a hole with their hand, and you can put it on your arm or you can put it on your leg, and I just have them pack like that. John helped me out with a dummy. What I love to do is get a piece of meat, like a rump roast or something like that, and I make a few stab wounds. And bullets like to travel path of least resistance, so they might hit a bone and divert. Yeah. Oh, nice.
There's the meat.
Thank you. Thank you. Okay. Awesome. Anybody want to stab it? Please. Oh, yes, ma'am. I have about 10 pairs of gloves, if anybody needs any. Here they are. Or will you stab mine for me? Yeah, if you don't mind. One good, like, make sure you, like, really get in there, do it good. No, like, here. Like that. You want to get a pathway, like a bullet, okay? So I have my non-dominant hand, I have my dominant hand. And when you're packing a wound, when this comes unraveled, it makes a mess, and it's kind of, but let's just say it does. You're nervous, and you haven't done this before, and it just comes undone. You take your non-dominant hand, your dominant hand, you stuff it in it. You want to feel with your finger the path of the bullet or the path of the knife, and you really get in there, and you're just packing, stuffing it, stuff. Keep stuffing. If you run out of gauze, then you get another roll. So everybody, and if you want to do it on this piece of meat, feel free. I have gloves. Okay, so are we ready for next step? Okay, so you have your wound packed. You're always holding pressure the whole time. You never stop pressure, even you have it all the way filled up. Now, personally, I was taught that you pack it even above the wound, okay? Because it just gives more pressure. You pull out your wrap. I was taught to start on the side, not over the wound. You start on the side, and you wrap it around, okay? You wrap it around once, one good time, and you're pulling, okay? Pulling tight over the wound. And then for the second time, you make a twist over the hole. over your packing, okay? Wrap it around again. One good time. Second time around, making another twist. This twist gives strength and added pressure on top of your wound, okay? So you're just going to keep doing that.
The twist is on the top.
Yes, sir, over the wound, on the top. Oh, you go around once. I mean, some people twist every time. I think that's unnecessary, but whatever, you know, whatever that you want.
Not being judged.
Right. Right. And so you just keep doing that, always holding pressure, never letting go. And then the last and final time, so some gauze have this Velcro. I've seen it come off so many times, I can't tell you. It's not trustworthy. Even they have these little metal clings. Those will come off also. So I was taught that you tuck it in. It's supposed to be, it's going to be so tight if you do it right. It's going to be so tight, it's going to be hard to tuck that in, but just find a way, okay? So that's our next.
Tightness is important.
It is imperative.
Imperative. Okay. So you're not trying to not hurt them, like you're just not worried about that.
Yeah, they're already hurt,
Yeah.
right? You're not going to hurt them worse by saving there, right? The reason why we have to pack so tight and wrap so tight is because your packing can come dislodged. Because you are going to transport your patient. You're going to have to move them at some point. And when you're moving, patient transport is very clumsy, and I'm sorry, but it is. They could fall off your gurney. You're gonna hit them on things. It's unfortunate, but you're panicked. You know, you're trying to move, so you can come dislodged. So the tighter that you pack it, the tighter that you wrap it, the less chance it has they're gonna come dislodged. Okay. Always and I'll go over this again later, but after you move your patient, you're going to assess again to make sure that it did not come dislodged. How do you know that? By checking capillary refill, making sure that there's still no blood coming out of that area. The A in March stands for airway, and this is where we will use a nasal pharyngeal tube. Now, there comes many sizes of this. And how you want to make sure that it's long enough going to reach their airway. You measure from their nose to their ear. Just like in this picture, the nose to the ear. Now, some of these kits come with lube that's sterile so that it will feed easily through. I mean, these are rubber, right? And you're going to meet resistance. Let's say that you don't have lube and you're meeting a lot of resistance. You will take this and put it in the patient's mouth, not your own, and put it in somebody else's body. You put it in their mouth, in their cheek, lube it up, and stick it in their nose, okay? Very easy. When you're done with this, if they're unconscious, which most likely they will be, or else they'll be able to breathe through their nose just fine, you will roll them to their side with their knee bent. We don't want them to vomit and asphyxiate, okay? Asphyxiate is like you can't breathe and you die of lack of oxygen. If they're not breathing, let's say they're unconscious and you open their mouth and they're not breathing through you put it. Well, yeah, you're right. I'm sorry. What if they're it's so they don't, if they're vomiting, it's not gonna.
So a lot of times we use this if they're unconscious and they cannot maintain their own airway. So if you do, hit tilt chin up and it opens their airway, they start breathing again.
Yes, I don't know how to explain.
Maintain that
Yeah.
airway.
Yes.
So you put it in there and it goes down past the back of the tongue and keeps that airway.
Yeah, if there's an occlusion, I'm sorry. Sometimes I forget my words. It's not that they're not able to breathe with their lungs. It's that something is blocking, and so you want to create an airway, so that they can breathe. I'm sorry, y'all. Okay. Respiration. So this is called the box, from the top of your lungs to about your belly button, because your diaphragm raises up and down. This is your box. A lot of times when you have a bullet wound, bullet's going to travel, right? So you're going to have an where it came in and where it went out. So most times chest seals come with 2. Sometimes they don't. Sometimes they only sell 1. So when you buy chest seals, make sure that your package comes with 2. I like to have at least 2 chest seals in my kit because a lot of times people get shot more than once. So with the chest seal, first of all, while you're opening this, hopefully you have somebody that can hold. Oh, sorry, I keep hitting the microphone. You have somebody that can hold the wound closed. You take out your chest seal. Now this is something that's really important to remember. You're gonna be panicked. You're gonna be like, oh my God, I gotta hurry up because this person's gonna die. And you do want to have, you do want to hurry, but you don't want to rip it and then it comes closed because this is very sticky. And if you open it too fast, then it's gonna stick on itself. Okay, so keep that in mind. A lot of times these kits come with a sterile gauze so you can wipe any sweat or secretion that have come through. There's usually not a lot of blood with wounds, with gunshot wounds to the chest. Yes, there is vascularity through the lungs, but for some reason we just don't see a lot of blood come out. So you're gonna pull it out, roll it out. This one is pretty old. You want to peel it like this. Okay, this is not perfect like it used to be, but you want to be careful not to yank it, especially when it comes to the end, so it doesn't, how you call it, like go like this and fold on itself. When you're applying the chest seal, you want to kind of roll it on. You don't smack it onto the person because it will not seal correctly. These have valves on them. Back in the day, we didn't have these valves, and we had to burp, we called it, and release the pressure from seals. If you come into a situation where you have a chest seal that's flat like this, you will have to like let go of the pressure. Now, alternatives. Let's say you have more than 1 wound. So I can use this for the other side. I can open this up and use it also. I can find anything that's like my Mylar blanket. I can use any flat surface to plug the hole, okay?
What is in the gun wound, isn't it a lot more damage on the back, the access side?
Right, the pressure, how you call it, the velocity, the right, yeah, the physics, like the force, that's what I'm looking for, the force.
You don't pack that chest seal or
This, no, sir, because it needs to breathe, it needs to be able to, oxygen needs to be able to come out and release, release pressure.
So when you're packing this is into the meat?
Right, this is,
Not into the box?
correct, very important. Chest seals are only for the box, okay, because your lungs and your diaphragm. Yes, ma'am. No, ma'am. Just whatever you find first. No, ma'am. You just whatever is closest to you. Just that. You're always going to feel on the back of your patient to see, even if you can't. Like, well, you will want to put eyes on it, of course, but you want to assess your patient. You feel along their back. Yes, sir.
So, commonly you're going to see an entrance in the neck, like you're talking about, right? So as you're looking at the patient and everything, like how she was able to separate those two. Okay, so as you're seeing, you've got that one, and then if you've got help, that's great. If you just be opening that the next for you, and then you can check to see if there's anything on the back. If there's anything on the back, you use any one of those adjustments, whatever, still closed, right? Just like this, and you know he's got one here, you roll. So, if I notice he's got that one here, it's like open up the adjustment, accept it out, we got one back, and go on a little bit, push this underneath, push it back down. Now, this approach to dressing is gonna be fine, just until you feel the one on the back, and that spare one that he has, we'll put tape around it, and then we can lift them up, put the one with the
Yes.
So I'm passing one around.
Yeah, they come in standard size, but I'm sure they make for like super
I
obese.
make compact ones depending on the kit that you have. Like
Mhm.
the one I have in there is, I think it's a 2-pack of compact ones because this is a smaller kit.
Not much of it. Now, so, you're talking about a full metal jacket, round, like most of the shoe that we have. It'll be a little bit bigger, so, you know, your interest really might be like that. You know, small round, you might get, you know, something size for like $5 maybe. Yeah, softball size.
Yeah,
Under,
these are plenty big. Yeah. See this hole, this will most definitely cover a rifle round. Yeah. Yes.
So
So-
I did have a quick question. Does everyone know why we put a check seal on? Like,
I was just thinking, so when he was talking, is it because you want to keep the air in there?
Right.
So you can think of it like you have a regular bottle with a balloon inside of it. Your diaphragm actually expands the volume inside of your chest cavity. When you have another wound in it, and you have another opening, suddenly that system doesn't work. So
It's pressurized.
They will be inhaling, and the air will come in through the hole and go into the chest cavity and not the lung. So that's why it's important to seal that. One of the cues that I was taught when you do apply a chest seal to someone is you tell them to exhale.
Yes.
To get as much pressure out of that cavity as possible.
Best if done on exhale. So even if the patient is unconscious, you will wait. It's best done on exhale. It's still going to work even if they don't, but it is best done on exhale. Now, when you're done, if the patient is unconscious, then you want to roll them on their side. You want to put the wounded side down because that's already a bad lung. It's not going to have the full exhale. And then if they're conscious, sit them up. In my kit, because I'm a nurse, even I'm technically not supposed to give oxygen without a doctor's order, I still have a little can. It's more of like a distraction. It's more of a making them feel like they're getting more oxygen because they're going to be panicked. You know, one thing that I tell patients is it's okay. You can still live with just one lung. You know, people think, oh my God, I'm going to die because I have this one lung that's damaged. You're okay. You can still live with one lung. Okay, and then I do my seal, and then when I'm done, if they're conscious, then I give them this little oxygen thing that I found on Amazon, so they can kind of self-administer. Again, it's really not getting a lot of oxygen into them. It's not like a nasal cannula, but it's just, it makes them feel better. So, okay. H is for hypothermia. Cold bodies can't clot. When the body is just too cold, even you pack their wound and things like that, it's just going to continue to bleed. Okay, it might not. Well, it will eventually bleed through the bandages and stuff, but it can just keep going into the tissue. So I, in my kit, always keep a Mylar blanket to keep them warm. Even in Texas, even in 100-degree weather, yes, they can still get hypothermia, and they won't clot.
So the purpose is, I thought it was if they were cold, but you really want, it's because it can't clot.
When you're in this shock, their body cannot self-regulate any longer. Its only focus is keeping the blood in the core and keeping alive, getting the blood to the brain. So yeah, you want to wrap them in a Mylar blanket. Now, what are some signs of shock? They're going to be pale, clammy. They're going to look like they've been on drugs. Their pupils are going to be pretty big. And then you can have a bluish, purplish. People say bluish, but with my eyes, I don't know, different color eyes see different, but it looks more purplish to me, the nail bed. So when you're going in shock, all the blood is shunted from your extremities to your core. So you're going to have less perfusion to your extremities. Let me just make sure I didn't skip over anything on this. Oh, right. when you're assessing that, you're saying, okay, did I do my chest seal right? Is my patient getting better? They're going to, first of all, they're going to be air hungry, right? Air hungry is like they just can't get enough oxygen. They're going to, if they're conscious, they're going to be tripoding. Okay, if that is going down, shortness of breath, rapid breathing is going to go down. They're going to start feeling better, okay? Now, of course, they're going to be anxious and everything, so it's going to take a little while for them to calm down, but you want to assess, at least, once you know that you did it right, you want to assess that at least every 10 minutes. They say 15, but me as a nurse, I like to keep better eye on my patient than that. Now, the paleness and the sweating should decrease, and the panic, distress as well should be decreasing. Yeah. One thing we always say in the military, if the face is red, raise the head. Now, in signs of shock, the face is going to be pale, raise the tail. Okay, okay. Okay, and that's it. Do you have any questions? Raise the head. If the face is pale, like in signs of shock, raise the tail. Okay. And I mean, if anybody want to add anything that they learned in their TCCC courses. Yes, sir. Right. But in shock, it's going to be pale. So you want to raise the tail. Yes, sir. Sure. Sure. Sure, we can get that together and put it on the PrepperNet website. I probably should have added that on a slide, but I didn't think about that.
I got a medical pack, and I don't even know what's in it. I don't know what, I just went for it.
He was saying, can I put together a list of things that you should have in your kit and where to find them? They do sell kits on Amazon that are put together. Oh, thank you. Sir, is there any way you can open this for me?
Sure.
I don't know what's wrong with me. Oh, thank you. Bless you.
And the fact that she did on the March, you go on Amazon, there's kind of like a little mini card, but you put in March card, so it'll fit into a lot of these first aid kits around here, so in case you're nervous, you've got somebody else who doesn't know what's going on. Yeah, see,
Yes.
there you go. And then there's kind of one for $6, or 60 cents, you know.
Yes. Okay.
There's a couple different theories on the medical kits. You can buy like a pre-made one. So this one is actually from Refuge Medical. This is called the SOB kit. It's small as that. So I actually put this on like a battle belt, just in the back, and it stays out of the way. It's there if I need it, and it has compact chest wheels, gauze, obviously a tourniquet stage, ready to pull off. But it's really just dependent on your scenario. If you're not going out fighting, then you might not need one. You might be better off having a trauma kit or one that just my everyday. So this is my backpack, and it's just something that I can grab. Usually I have a blue tourniquet on top, so if I need somebody to get this for me, I go, hey, go in the bag and find the blue thing. So they're gonna go, hey, this is the blue thing, this is what you need, right? So it's really just dependent. There's probably you guys have seen the 5 or 6 components that we typically, or that most of us recommend: the tourniquets, the chest wheels, the pressure bandages, the gauze, and maybe a tourniquet. That'll save you from most March algorithm related.
I don't. I don't.
I've seen that movie. Also, I mean, they're worried about disinfecting. They're worried about infection. In this situation, I'm not too worried about that because we have hospitals that are at most an hour away. You're not going to die of infection. You're going to die of bleeding out.
Yeah, that takes precious seconds out of your stopping the bleed time. So I don't. I would afterwards, but excessive amounts of alcohol, of course, is gonna thin the blood. So we don't want to. But a little thing ain't gonna hurt nobody.
What about liquid Band-Aid or anything like that? Carry those in your pack?
For minor things, but not.
Glue or whatever,
Yeah, we use that for suturing.
case of duct tape.
Little things, yeah, steri strips, liquid Band-Aid.
So, there's a couple of things. You brought up about the blue tourniquet. Of course, they come in different colors, and that's it's kind of nice. Also, it's high visibility, so when somebody is, when you're passing them off to an ambulance team or something else, they can quickly and easily see it. Sometimes
Yeah.
black on black, it's just,
That's true.
bright orange like that, they can't help but see something like that. And also, when you're telling somebody, I want something on my bag, they don't know what a tourniquet is. Then, like you said, just stick you on with the blue thing.
Hmm.
They've got different bags, which is kind of good if everybody's able to show what they're carrying. He's got a really nice drop leg one that is small and narrow enough, like you would go to brands, whatever else. And all he's got to do is rip it down, and it's got all of the stuff up onto it. Everybody's got different things. Like I've got one for my car. He's got more of a backpack style. I've got a range bag that I keep stuff in one of the outside pockets, and it's marked. It's got tourniquets and pressure gauze and chest seals into it. Other than that, that's basically everything I do. Everybody's got different things, so still take time, show it, that would be great.
One thing I forgot to mention because I left off my slide, there's alternatives for tourniquets. If you don't have one, what are some ideas that y'all would use? Belt, okay, towel, right? A long time ago, there was no such thing as tourniquets like these that we have. So what did we use? We used triangle bandages, and we would use a pen or a stick. Before we had these fancy guys, you use something that was hard to. You would tie the knot over, the artery, put something hard. Hopefully you can find something, at least double up a pen or something like that. Use that as the window. Right, stick. I mean, of course they can break, but whatever you try, make a knot over those, and then use those as a window. The window is that little stick on the tourniquet, and you would use that to tie it down. Yes, sir.
There's one thing, if you go on Amazon, if you don't have tourniquets yet, and you see these great price tourniquets for 10, 11, 12, 15 bucks,
Oh yeah.
don't buy them.
No,
Because
they'll break.
the cheap Chinese crap,
They will break.
and the windlass will break,
Yeah.
and then that person will die. I mean, that tourniquet now is what, about 30 bucks?
Yeah. 34. Yeah.
If you're not spending $30, you're not getting the right thing.
Exactly.
The best rule for medical stuff is don't buy it off of Amazon. There's a absolute ton of counterfeit product on there for everything, but especially for the medical stuff. It's just medical stuff essentially to save your life. That's not the place to get it.
Yeah.
North American Medical, Refuge Medical, ITS Tactical, who makes this kit. Yeah.
Oh, nice. Thank
Spend
you.
the extra money, 'cause you don't
It's
wanna
worth
break
it.
when
Yeah.
you really need it.
Yeah.
That's when it's gonna break.
There's an.
So if you use it to save a life, they replace it.
Oh, nice.
So anything you use in a car wreck or anything, and you tell them because they want the story, they will replace whatever you use to save that life, whether it's a tourniquet, driving cars, doesn't matter.
Nice. So they have this new junctional bleed tourniquet specifically for junctional bleeds. It's $350, but if it's for your home or maybe a group setting or something, maybe you have a bug out location, you decide if it's worth it. But it's that way you don't have to. Oh, do I have two tourniquets? No, I actually have this junctional bleed tourniquet and it has pressure cuffs in it to hold pressure, and it's very heavy duty.
Yeah, one thing about